Hello and welcome back to GP Video Podcast by Nadia. So today I'm going to share with you a dilemma of mine that I generally see in my general practice. So as you know that chronic pain is one of the most important conditions one of the most common conditions that patients present with to a general practitioner in general practice, and same is the case with me. I usually see three sorts of patients, and of course there are going to be three sorts of patients. Two are two extremes and one is the moderation line or the moderate sort of patients. So the two extremes are, number one is the patients who deal with chronic pain, have got causes of chronic pain like, let's say, fibromyalgia or arthritis or degenerative diseases or any sort of cause of chronic pain. There are lots and lots of causes. Those patients, because of the societal pressure or societal norms or their own thinking or their own fears, they do not take any sort of pain meds. And they just soldier through, and then they just say that, okay, this is an act of bravery and we are not going to take any sort of pain meds. And of course, bear the consequences. Then there is this next extreme, the other extreme. People who have got very low threshold of pain tolerance and have got causes of chronic pain and eventually become opioid drug dependents. Then there are, of course, moderation. There is a moderation. There are people who take pain meds as prescribed and take as needed, are on long-term pain medications as well, but take them in moderation and are not dependent on the pain meds. So those are the patients. But then again, this moderation population is low in number. The two extremes constitute the majority of the patients. So either dependent on pain medications or do not want to take any sort of pain meds. So I would like to actually address anything in extreme, even drinking excessive water or extreme amounts of water is dangerous. So anything in extreme is bad. Moderation is the answer to everything. Not taking any sort of pain meds is absolutely bad. Becoming absolute dependent on opioid medications is also bad. Moderation is the line. In my view, not taking any sort of pain meds is actually not an act of bravery. It drains you of your energy reservoirs. It drains your body of all the energy reservoirs. And when you go towards your old age, your body is already depleted of all the nutrients, all the energy, because your body was fighting with the pain when you were young and you were trying to be very brave and you were not trying to take any pain meds. So that is really not an act of bravery. I've got some beautiful excerpts here to share with you in beautiful English, and would like to read them for you. I might not be able to finish them all in few video podcasts, so I would have to make 5 to 6 at least on this topic. So we need to understand the chronic pain and its consequences, okay? So, the spectrum of pain tolerance among patients can illustrate two extremes. Those who endure pain without the aid of pain medication, and those who have a low pain threshold and may become dependent on opioid medications. Understanding these two extremes can reveal not only the complexities of pain management, but also the varying approaches individuals take when confronted with discomfort or suffering. On one end of the spectrum, some patients embody resilience, opting to bear pain without any pharmacological assistance. This approach may stem from personal beliefs, cultural norms, or past experiences that condition them to view pain as a necessary aspect of life. While this stoicism can be commendable, it often comes at a cost. Chronic pain can lead to physical limitations, emotional distress, and a significant decline in quality of life. These individuals may be reluctant to seek help or utilize available pain management techniques, believing that enduring the pain is a sign of strength, which definitely it's not. Conversely, at the other end of the spectrum are individuals with a low tolerance for pain. These patients often seek immediate relief, which can lead to over-reliance on opioid medications. This dependence may initially provide comfort, but can quickly spiral into a cycle of addiction, where the need for medication overshadows the original pain issue. This journey may start with legitimate medical need. However, the risk of developing tolerance and requiring higher doses can transform into a precarious situation. The potential for opioid dependency can lead to additional physical and mental health complications, further complicating their pain management. Both extremes highlight the importance of personalized pain management strategies. It is essential to recognize that pain tolerance varies significantly among individuals, and there is no one-size-fits-all approach. Effective management should consider the patient's unique circumstances, providing a balance between pharmacological intervention and alternative therapies. Open communication with healthcare providers can help bridge the gap between these extremes, fostering a more comprehensive understanding of pain and its implications. In conclusion, the dichotomy of patients who bear pain without medication and those who become dependent on opioids underscores the complexity of pain management. Recognizing the individual differences in pain tolerance is crucial for developing effective treatment plans that prioritize both relief and overall well-being. We'll come back to this topic tomorrow.